of Origin Global. Naeem has extensive experience in inclusion of early interventions and training in mental health, and also he's worked and been incorporated in global health organizations such as WHO, the UNICEF, and USAID, where he's worked as a consultant. In supporting the COVID-19 response in Africa, through the support of First Aid Africa, Naeem curated and developed a locally tailored basic psychological first aid course that is available on the Kaya platform. He has been recognized as a key ally by the WHO Africa and CDC Africa, and serves as a frequent expert and also gives advisory services on regional mental health through stakeholder engagements. Dr. Dalal is an academician with the University of Zambia and is currently serving as interim board member of the Healthy Brain Initiative, whose mission is to improve the lives of people affected by neurological and mental health problems. He is a sought-after expert in mental health, and so we are very privileged to have him present to us about mental wellness this month. Dr. Dalal, please proceed.
Speaker on, or? Okay, all right. A warm good afternoon to everyone. Thank you so much, Dr. Munalula, and I'm very honored and humbled to be in your presence today. Thank you for inviting me to your community. As Dr. Munalula has said, I am a Zambian medical doctor focusing specifically on mental health, and I'm here to share with you specifically on mental health, wellness, and what is it that you can do to focus on your own well-being. One of the things that we've gone through in the past 2 years is COVID-19. And COVID-19 itself has changed many things in our lives. When I say many things in our lives, I talk about our day-to-day experiences, which have been affected. And this has led to a strain on our wellness and our mental well-being and our capacities in particular. So in the next 45 minutes or so, I will be specifically focusing on how is it that mental health can turn into a mental illness, and what are the things that we should be looking out for. Because when we think about health, health is actually a complete state of three things, okay? Health is a complete state of three things. And oftentimes, because of our understanding of health, we often just focus on one of these three things. So what are these three things that health is focused on? It is focused on our physical well-being, and this is why whenever we are physically unwell, it's very easy to tell. But then there are also two other pillars of health, which we talk of as our mental and our social well-being. So health is a complete state of three things: your physical, your mental, and your social well-being. So when we say physical, we know it's our body, what we can see, how we are feeling. So when you go to a healthcare service, you're going to find that they're going to ask you to say, have you been feeling different? Have you had a fever? Your temperature, has that changed? So this is your physical health. For instance, if you fall down, you hurt yourself, you're going to see a bruise. If you cut yourself, you're going to see blood. So this is your physical well-being. It's easy to see. And this is what we focus on a lot, especially here in our community and in our country here in Zambia. But then there's two other pillars of health, which is our mental and our social well-being. So I will focus more on the mental part and also talk partly about the social pillar of health as well. So what do we mean by our mental health? When someone asks you to say, what is it about mental health? When is it that you should come to me as a healthcare worker to say, I am mentally not feeling well? How do you know? How do you go about defining that? So mental well-being is simply how you see things, okay? how you perceive, how you hear things around you, and your ability to go about your day-to-day life, your ability to be productive, your ability to be functional without feeling overwhelmed. I'll repeat that. Your mental health is simply your ability to go about your day-to-day life without feeling overwhelmed. And what is our day-to-day life? Our day-to-day life involves us working or being productive, going to school, being in a community, being in a family, our ability to be able to perceive things, to see things, to be able to interpret these things in a good manner, our ability to hear things and interpret that as well, our behaviors, all of these things make up our mental well-being. And this is very much part of your overall health and well-being. Now, when there is a disruption in your ability to focus in your day-to-day life, is when we say your mental health is at a difference. Now, I would like to let all of you know that all of us have mental health. Okay? All of us have mental health. The difference is when that mental health is affected is when we say you have a mental illness. And this is something we all need to understand. You need to know that all of us have mental health. But it is when that mental health is affected when we say it's a mental illness. There are times when something will happen in your life, you will receive some kind of bad news, you will go through some grief, you will have certain ups, certain downs, and your mental health will be affected. But that does not mean that you are mentally unwell. That is very normal. Reality is all about uncertainty. Things do happen. Bad news does come. Happiness, sadness, these are all parts and parcel of our reality. And how we respond to that, if we become very sad or if we become very excited, that is your mental health and that is very okay. But when that feeling okay becomes very overwhelming and you are unable to focus and function for days on end, 1 day turns into 2 days, 2 days of sadness turns into 4 days of sadness, 4 days of sadness turns into weeks of sadness, and you are not productive, you are not able to function, you are not able to focus on you. This is when we say you may be at a risk of a mental illness. So again, I will repeat this, all of us have mental health. Okay? Now, when we talk about health, I already said there are 3 things: physical, mental, and social. What do we mean by our social well-being? Our social well-being is right now what we're doing, coming together as a community, being one other's support structure, the ability to be part of a community. That is our social well-being. This is very much part of our health and well-being. Because as humans, as human beings, we are a social being. We are part of society. And this is very much important for our overall health and well-being. And when that is disrupted, that in itself can actually lead to certain health problems. So health is not just the physical part. And this is one thing we all need to start understanding. It is also our mental and our social parts as well. Because when you're unhealthy overall, you may start withdrawing yourself from your social environment. You may start withdrawing yourself from your day-to-day activities and maybe isolate yourself. This in itself is also another sign that shows that you are not healthy. And if you are not healthy, that does not mean it's the end. It simply means you need to reach out for help. Just when you are feeling a fever, when you are feeling some kind of pain in your body, when you're involved in an accident, and you reach out to a doctor. Similarly, when you're feeling overwhelmed with your emotions, when you're feeling overwhelmed because you're feeling isolated, when you're feeling overwhelmed because you feel this sadness that is not going away, when you're feeling overwhelmed where you're not able to focus on your day-to-day life, your work, your home life, your schoolwork, that means you need to reach out for help. And this is where we, as mental health professionals, come in to guide you. Now, that's simply a definition of what mental health is. Now, if I was to ask you to say which part of the body are we talking about when we are talking about mental health? Because when you hurt your bone, you know your bone is hurt. When you feel some kind of pain in your stomach, you know you're going to say that I have a stomach pain. That's the stomach, okay? When you have certain symptoms, you know which parts of the body are affected. Now, when we talk about mental health, which part of the body are we talking about? Yes. So we're talking about the brain. Now, we all have a brain. Now, what you all need to understand is that it is not easy to see the brain. It is not easy to tell. For instance, if I am feeling overwhelmed, it will not be easy for you to tell that there are certain things happening in the brain that is leading me to feel overwhelmed. And this is something you all need to understand, and this is why mental health for so long has not been easily seen or understood. But we all have a brain. Now, for the next few minutes, I'm going to take you through the journey of how the Almighty has given us this brain, how it forms itself, and how it works, according to how we understand it as healthcare workers. Now, the brain is one of the few organs, if not the only organ, that still develops until the late 20s. I'm going to repeat that. The brain is one of the only organs in our body that is still developing until you reach your late 20s. So until you are 30, 31, your brain is still developing. I'm sure many of you as parents or guardians have heard that for young ones, we often focus on under 5. Even in our country, our healthcare system, we have what we call the under 5 card. Why do we have under 5? Because that is the time the immunity, the body's ability to fight infections and immunity is developing. So you need to focus on the under 5 to make sure the first 5 years of a child's life, you are focusing on their nutrition, you are focusing on their sleep, you are focusing on their behaviors very well. But when it comes to the brain, it is not just under 5. You have to constantly nurture the brain until the mid to late 20s. Because the brain is an organ that is still forming. It is still developing. Now, one key part of the brain, which is its function, is what we call emotions. Emotions are simply how we feel. What is it that you're feeling? Different types of emotions. Chimwemwe, happiness, okay? Surprise, anger, disgust, all of these are emotions. And the part of the brain that is responsible for these emotions only starts developing when an individual reaches the age of 8 or 9, okay? A child starts understanding emotions like happiness and sadness when they reach the ages of 8, 9, and going up. They do understand those emotions. A 7-year-old or an 8-year-old will tell you to say, I am happy, I am sad, I am angry. But then, there is another part of the brain that is responsible for controlling that happiness or that sadness or that emotion. So the brain in itself has different parts with different functions. Now, it's very important for you to understand this because that part of the brain that controls when you're angry and when you do something and later on you realize that that was wrong, it's a completely different part of the brain. And that part of the brain starts developing at the ages of 16 to 25, 26, 27. This is why when adults grow up, when they're in the 30s, that's when they start thinking, when I was an adolescent or when I was a teenager, why did I do that? What was I thinking? This is why today you will see majority of young people making mistakes, not understanding what they're doing. It's because the brain is still forming, and the structures that are responsible for identifying and the structures that are responsible for controlling are still forming. And I hope this is something that we are all starting to understand as well, because the key part when mental health changes from mental health to mental illness is in adolescence to early adulthood. I'll repeat that. When do mental health illnesses start? Mental health illnesses start in early adolescence to early adulthood. For the same reasons, because the brain is still in its formative years. It's still forming. This is why, coming back to the first part of my discussion and my definition was health is a complete state of physical, mental, and social well-being. Social well-being, which is where we are right now in a community, it's very, very important. Because for you to harness mental health in our communities, we need to make sure we have a good social support and a good social community. Because young people and young adults need a good society to guide them, to support them as their brains are still developing. When they make certain decisions that are not right, that are not 100% in keeping with well-being, this is where guardians need to come in, understanding very well that they're still developing for them to be corrected on what is right and what is wrong, without necessarily coming from a point to say, you are wrong and this is not how we do it. But rather coming from a place of, this is not the right thing to do, you are still learning and this is what needs to be done. And I say this because one of the leading causes of mental illnesses in our country here in Zambia is that of vices and bad coping habits such as illicit drugs and alcohol. And when does that key vice or bad habit start? In adolescence or young adulthood. It is when the brains are still developing, it is when there is no guidance or no proper structure or support, when young adults start partaking in these bad coping habits. And they are actually taking those habits not because they want to, but because they are most likely self-medicating their stresses and challenges. And these are key things to understand, especially for young adults. You need to understand, as young adults, you need to understand that when a guardian comes to you and guides you, they're coming from a good place. And adults and guardians need to understand that when a young adult makes a mistake, let's go to them from a point of communicating to them to say they are still growing, their brains are still formulating, and they need that guidance, without belittling them or without coming from a place of punishment. So now, this, in a nutshell, is how mental health turns from mental health to mental illness. Another thing about mental health and mental illness that you all need to understand is the point about how long do mental illnesses last? Is there a cure for mental illness? Are there different types of mental illnesses? The answer to all these questions is that mental illnesses oftentimes are long-term. They are continuous. There are no two people who may be experiencing a certain time of mental illness that actually experience it the same way. If, for instance, I have depression, doesn't necessarily mean that the person next to me who may also meet the criteria of depression is experiencing the same depression. With mental illnesses, every person comes from a different background and experience of their strengths and symptoms are very, very different. So mental illnesses, majority of them are actually continuous and they are chronic. When I say chronic, oftentimes they run for a few months to a few years. There are many, many different types of mental illnesses. Just the way we have different physical health conditions, infectious, non-infectious, in physical nature, we have many, many different types of mental illnesses. There are mental illnesses that present with different types of behaviors. There are mental illnesses that present with different types of feelings, emotions. There are mental illnesses that present with different types of perceptions, how you view different things. But I'm here to tell you that even here in our country, we do have services and treatment. All mental health illnesses, irregardless of signs and symptoms or severity, can be treated. And the treatment is such that an individual can be productive and functional and go about their day-to-day life. It is just that we do not understand that the stigma that we have in our country is making people stay away from coming for help. But we do have treatment. All mental health illnesses have a treatment. And we do have these services in Zambia. Okay, so at this point, I'm going to pause and I'm going to ask if there are any questions before I continue with the second part of my talk. Yes, sure. Okay, all right. So I've been asked, where are these mental health centers? So at the moment, seeing as we're in Lusaka, I'll focus on Lusaka province. Of course, we have the major hospitals such as the university teaching hospitals. We have Levi Mwanawasa Teaching Hospital now. And then we have peripheral first-level hospitals such as Konyama General Hospital, Chawama General Hospital, Chilenje. All of these hospitals have mental health units where you're going to find mental health professionals such as myself, mental health clinical officers, psychiatrists, mental health nurses who are able to support you. Further, in our curriculum here in Zambia, all medical doctors, before they graduate, go through a basic understanding and module of psychiatry and mental health. So any hospital you go to, should you elicit any signs or symptoms of mental health or illness, doctors will be able to assess you and triage you and refer you to mental health professionals like myself. I would also like to state at this point that in our country, since COVID-19, but even before that, we actually have a toll-free Lifeline. So we do have a toll-free Lifeline. And the toll-free Lifeline is 116 or 933. 116 or 933. Should you experience any severe psychological stressor or distress, or you're experiencing any kind of challenges in your homes, you can quickly call that number and they will be able to guide and support you. And of course, we do have our tertiary mental health hospital called Chainama Hospital. Now, I would like to let all of you know to say, we have stigma towards Chainama, I understand. But Chainama is not what it's meant to think, what we often think or believe it to be. There are outpatient services where when you go to Chainama, you will be assessed and you will be guided and you will be treated from there and you will get the support that you need. And there are also inpatient services should those be needed. Further to that, Chainama Hospital also offers other physical health concerns. They have one of the best physiotherapy departments in the province as well. So there are many, many other options that are offered at Chainama as well. So please don't shy away from Chainama Hospital. Please, that's where we can also get mental health services in the province here in Lusaka. Thank you. Do we have any other questions?
Thank you. I don't know if it will be relevant to the discussion, but the biggest problem, from my experience, is to convince someone that they are probably mentally ill, and just to get them to say, we need to take you to the hospital because you're not ill. Because especially for those that have very subtle tendency of mental illness, how would you get to convey that kind of message? Thank you.
I appreciate that question because that is very clear. One of the reasons why many of us, even though we may be showing some signs or symptoms of mental illness, we're not open to reach out for help, is because of the stigma that is there in our community. But the stigma also transcends to us as individuals who may have mental health symptoms, and we stigmatize on ourselves, not believing that we can actually get the help or the treatment that we deserve. That is a two-pronged response for that one. The first one is what I'm doing right now, and I'm grateful to my senior and my colleague, Dr. Munalula, for inviting me here, where we are creating awareness so that people are aware that, we should reach out for help when we feel we need it. But then on the second part is also, we all as a society need to start upskilling ourselves in basic communication skills on how to support or de-escalate certain situations that involve emotional stress or psychosocial stress in our communities. So there are many, many ways that we can upskill ourselves, and one of the basic skills that we are trying to also enhance and promote in our communities is what we call psychological first aid. So what do I mean by psychological first aid? It simply means there are certain things that you can do in that situation where you know that this particular individual will benefit from mental health support. What is it that you can do to actually make them, one, realize that, two, accept that they need help, and three, allow you to take them for that help. So in such skills, there are certain things that are imparted in individuals, such as deep and reflective listening. Oftentimes, when you identify individuals that are overwhelmed or they're psychologically distressed or emotionally overwhelmed, and you want to bring them for help, they will often feel that they are being targeted. They will often feel like you are saying that they are wrong and they are not okay. And this is what we need to avoid when we talk about de-escalation. It's more about listening and asking that person to say, do you feel what you are doing is okay? If they say, yes, I'm completely fine, then you want to continuously keep listening and reflecting what they constantly say until they reach a point where they are calmer and they trust you enough for you to bring them for help. There are many times that that person may not even trust you despite you meaning well for them. This is where you ask them to say, who else do you trust enough who can actually link you with support? So these are the many things that we need to do. In majority of cases, if we have 10 individuals who may be showing signs of distress, 6 to 9 out of 10 individuals will actually accept that help. But we will always have that 1 to 4 people who may not accept that help. And this is where you actually need to trigger mental health professionals like ourselves so that we come and intervene. So this is where we actually say, for their own benefit, for that individual's benefit, we need to actually support them and bring them for services. So it's more understanding what constitutes an emergency and how we can bring them for help. But there's also the other side where communities as ourselves, we need to understand how is it that we can create a culture where we make it okay for people to accept help should they need it when it comes to mental wellness and illness. Yes. Gentleman at the back.
There's something we call total and temporary. I'll use the word insanity, although it's really not supposed to be used in mental health regulation, if you like. But for the purposes of this question, total and partial insanity. Total insanity is a person who is just, you can tell, they are gone. But partial insanity is when a person sees delusions. This is now from a legal point of view. When a person experiences delusions, but otherwise they are quite normal in their operations. In your practice, at what point do you take both these kinds of stages of mental illness or insanity, or there are just certain stages that you take them?
Okay, so just to echo the question is that there is this term known as insanity, and it's simply loosely defined as an individual that is not acting of sound mind, an individual that is not behaving, that is socially accepted in a community, okay? So that is insanity. And of course, as of 2019, April 6th, I even know the date because this is one of my good days, April 6, 2009, the Sixth Act of Parliament came out, repealing the old Mental Health Act, and now we have a new Mental Health Act in the Republic of Zambia. And in that act, we no longer use terms like mad, crazy, lunacy, insane. We have repealed all those words because those are stigmatizing and they are not befitting. We have now understood that mental health is brain health, and we need to accord individuals who have been experiencing mental illness be given the respect that they deserve and be part of society. So now coming to the term of behaviors that are not in keeping in society. So many mental health disorders actually present with that symptom of behavior that is not in keeping with society's expectations. This may be hearing things that are not there, seeing things that are not there, feeling things that are not there. It could be behaviors that are not right, okay? It could be thoughts that are not true. Contrary, despite having proof that no one is against you, or no one is going to attack you, or no one is after you, this person or this individual believes that that's all false and that they're at risk. So we call those hallucinations on one end and the others delusions, false fixed beliefs. Now, many mental health disorders actually present with these symptoms. Now, what all of you need to understand is that this is brain health. We have, in our country, we have many infectious conditions that affect the brain. And when that part of the brain is affected, that is responsible for how we see things. For instance, right now, this is a green mic with the number 8 on it. We are all able to see that. But there is a part of the brain that is responsible for us to interpret this. But because that part of the brain may be infected by a particular disease or a virus or a bug, the individual may not be able to interpret that. Okay? So there are many infections that can also affect the brain, and they lead to these symptoms. What infections are those? We have a high prevalence of HIV and AIDS. HIV is a virus that also affects the brain and different parts of the brain that lead to these symptoms of what we call psychosis, which is delusions and hallucinations. When the HIV virus goes to the brain, it affects that part of the brain, and so the treatment there is to control the HIV. If that individual is treated, is given medication for HIV, the virus is controlled, those symptoms will go away. Okay? We have other infectious conditions in our country like syphilis, which is very prevalent as well. Okay? It is a disease that can be transmitted through risky habits such as unsafe sex. Okay? So even in that situation, when that virus, a bug goes to the brain, it leads to what we call neurosyphilis and present with these symptoms. Okay? So there are infectious diseases that can affect the brain and present with these symptoms. Then, of course, we also have acute stress reactions. We are all able to withstand certain stresses in our day-to-day life, be it relationships, be it finances, be it our socioeconomic status, be it our friends and family. But there are certain stressors that we are not able to keep, because when they keep happening on a day-to-day basis, it affects our brain's ability to function and keep going. Whenever we are overwhelmed with psychosocial stresses such as financial stress, relationship stress, or day-to-day stress, which continues for days on end, for maybe months, it affects the brain such that it will affect your mood. You will feel either sad or irritable or angry all the time. And whenever you are angry, whenever you are irritable, whenever you are sad, there are chemicals firing in your brain. Number 2, your sleep will be affected. Sleep is very important and cardinal for brain health and well-being. When sleep is affected, either you sleep more or sleep less. Again, that can lead to challenges in your brain. And finally, your diet. You may not eat well, or you may eat excessively. So these three pillars of brain health may be affected, and when you have that acute stress reaction, you may end up seeing things that are not there, hearing things that are not there, or behaving in ways that are not there, triggering what we call an acute stress reaction leading to a brief psychotic episode. Again, that is temporary. Temporary in the sense that once you bring back your sleep, your diet, and your mood back into normalcy, those symptoms will go away. So this is why we call it brief psychotic episodes. Again, because of the stigma and lack of awareness in our communities, once a person starts behaving in a bizarre way, we stigmatize to say that is the end, that is mental illness, there's no coming back. Maybe it's spiritual in nature, or maybe, it's something that's happened. Okay? So these are things that we now need to understand. So there are many, many things that lead to these symptoms. And this is why we are here now. We understand the culture, we understand all of these things. So we are here to guide, and we are treating, and we are supporting individuals. Then, of course, on the other side, we do have mental health illnesses that do run in families. Mental illnesses are also genetic. They are biological. What do I mean by that? It simply means that there are certain traits that are passed on from generation to generation to generation. It's not just appearance where we say, oh, you look like your father, you look like your mother, you look like your sister, muparana. No, it's not just the physical appearance. It's also the brain's different structures at molecular level that is also similar. So if there's a family history of a certain mental illness like psychosis, schizophrenia, which is a mental health illness that presents with these symptoms, then there's a high likelihood that that person is probably going to end up having it as well. So these are things that we know, and these are things that we also start explaining and we actually treat. So there may not be cures for certain mental health illnesses where we can say it's cured, like, there are other conditions physically like diabetes or hypertension, high blood pressure. There's no cure, but there's treatment where you can control and prevent complications. Similarly, for all mental health illnesses, there is treatment and you can live a healthy life. So to answer your question, yes, it's there. We have it. It's very prevalent in our communities. But now we are promoting more and more awareness so that people come for treatment and they are fine. Yes. There was a question at the back.
I wanted to find out, since you have talked about 3 types of illness, I'm more concerned with the social illness. If you are able to communicate with certain people on social media, then physically you are failing to communicate that. Can that be a sign of social illness?
Okay.
Yeah, and the other question is, keeping the young ones indoor, can that lead to social illness as well?
Okay.
Thank you.
All right. So when it comes to the question there comes from the very first part of the discussion where I defined what health is. Health is a complete state of 3 things: your physical, your mental, and your social well-being. And your social well-being has to do with your society and the community that you are living in, the support that you are getting. Because as human beings, we are a social community. We thrive and grow in the presence of others. By supporting others, there is proven benefit scientifically on your physical well-being and your mental well-being as well. So coming to the communication element of social well-being, yes, society does, communities and social communication does enhance your ability to be better physically as well as mentally. But then coming to the point where keeping young ones closed, or, what we call military type, or rather helicopter parenting or guardianship, where you're constantly keeping a bird's eye view on children, what impact does that have? That depends on different societies and cultures. In certain societies and cultures, that can, if all communities are doing that and it's actually productive and it's okay, then it's fine. But if you're living in a cosmopolitan city like Lusaka, where there are differences in upbringing and parenting styles, and depending on where the child is going in terms of schooling or religious education or support or mingling or supporting, that can actually be a peer pressure kind of situation. So it actually depends what kind of exposure that you want to give to the child, but at the same time, where as a whole are we growing up as a community? Yes.
I have a question around people who may not be considered to be mentally unhealthy, and yet when you interact with them, they exhibit certain, I'll call them bursts of anger. Sometimes it may be in workplaces and different situations like that. You clearly see that this person is in an episode. So how can we as society members who may be interacting with such persons help them? Because maybe these are our superiors and we can't go to them and say, look, you might need mental health. So how best can we deal with those situations? And that is question number one. And then the second question has to lean more on the area where you talked about the mental health being an actual illness. Maybe these are episodes of schizophrenia and bipolar and all those other versions of it, where it's actually an entrenched disease. How best can we help people who we may actually meet who have such episodes? Thank you.
Okay. So starting with your first question on how can we help individuals who may be clearly showing signs that are not in keeping with social cues or social well-being. It could be a supervisor, it could be a colleague, it could be a parent, it could be a sibling. How is it that we can identify and say, this is not right, your behavior is not in keeping with what happened, or you are responding in a way that should not be the case in this particular situation? The answer to that is, I touched on this earlier, but as a society we need to start understanding and upskilling ourselves in basic psychosocial skills, in understanding, communicating, and being able to guide individuals in their comfort level. Clearly, when a person is angry and that person is communicating or saying certain things, if you communicate right there and then to say, what you're doing is wrong, can you behave yourself, or this is not how you behave, or you hold yourself, that is not going to help. Why? Because in that moment, the emotion part of the brain is firing neurons or firing chemicals that is just making that person feel overwhelmed. Until those chemicals stop firing, that person may not reason well. Similarly, apart from anger, the emotion of sadness as well. When a person is very sad and feel hopeless or helpless, there are chemicals that are being fired that needs to settle in the brain before you can actually intervene and tell them to say, look, this is not a good way to actually feel or behave. The point there is you need to communicate that, but don't communicate that in that moment when that incident or that situation or that episode is happening. You need to let that moment, right? And if you, in that moment, are aware that that person is wrong or not doing something right, you need to be the person who steps back and let that person behave or react in the moment. And when they calm down, that is when, in their comfort zone, you ask them, I would like to communicate to you, and this is not right, and how is it that we can help you better so that you can get the support that you need in terms of your anger or your sadness or any other situation you are in. Then on the second part, where there are individuals who do have bipolar disorder, and it's one of the top 10 admissions that we do see in our country here in Zambia. Bipolar disorder is simply a disease that is known to present with two extremes of the moods. An individual may feel sadness such that the person is very, very sad and is not able to overcome that sadness. Now, that sadness is not because that person is just feeling it, but it's because the brain is not able to control the chemicals that are responsible for that sadness. Similarly, the person will feel very excitable or irritable or angry. So they're what we call extremes of mood. They are unable to control those moods. It's as simple as the person simply gets maybe a little bit of a token of appreciation, some little bit of money, a reward, that person goes and uses it all up. Okay? So these are extremes of mood, and we call it either the depressed pole or the manic pole, the excitable pole. So that's bipolar. Then we have schizophrenia, where a person is not in keeping with reality. Maybe they hear voices that are not there. They are seeing things that are not there. They are behaving in ways that are not there. It's not that they're doing it on purpose. It's because the brain's different pathways are not fully formed, or the chemicals are not balanced. So this is where what we need to do as a society is to understand that, one, just like diabetes and hypertension, there is treatment. So we need to understand where is this treatment being offered and how can we link these people for those treatments. Because once we link individuals experiencing these episodes and these illnesses with healthcare providers like myself, I can assure you their symptoms are going to be under control, and they are going to, as long as they continue with their treatment and support from community, society, family, friends, and healthcare workers like myself, they are going to live a normal, healthy, productive life. The problem comes in when society does not understand, stigmatizes, individual also stigmatizes themselves, they don't come for healthcare, and because they're not coming for healthcare, they are at a higher risk of physical conditions like diabetes, hypertension, and then they end up neglecting themselves, and they end up prematurely losing their lives early on. So these are things that we need to understand. So the second question, it's more about linking them to services and getting them the treatment they deserve. Yes. Yes, sir. It's not working? Okay.
You can speak, Odamabena.
Yeah, Doc, I'm just getting concerned about the number of people that are committing suicide. Would you consider that to be as a result of a mental problem? And if so, how then can one help in such a situation?
Okay. The topic on suicide, and this is something, so I'm in a house of God, and we all have religious beliefs concerning self-harm and suicide. And there are religious guidance and support and understanding on suicide, it being not a right thing to do and a wrong behavior, which is very true. And when we talk about suicide, we also need to talk about it from a perspective of why is it that an individual would want to give up on life or not want to live? And this is where we now understand when it comes to suicide, we don't often say that it is a mental illness. We often say that it is a symptom of mental health. Now, a simple way I can explain this is based on brain health, chemicals, and different things. Oftentimes, suicide is a result of many psychosocial stressors or biological stressors that a person is inherited in their lives. But the simplest way I can guide you is, let's talk about anger. I'm sure many of us have experienced anger. We have all experienced anger in one way or the other. And when we're angry, we often do certain things that when we are calmer, when we are no longer feeling anger, we regret. It could be closing off completely and isolating yourself It could be walking away from that situation. It could be fighting back. It could be throwing something. It could be arguing. Or it could also use of foul language. This is how we experience anger. Okay? And in that moment, when we are angry, we are destructive. And in that moment, the chemicals are actually being overwhelmed. Similarly, another emotion that we often don't experience collectively, but we experience it at an individual level, is that of sadness. When we are sad, oftentimes we often isolate ourselves. We are not open, and we don't openly share our sadness. As a society, we do share our anger, but we don't share our sadness. Now, every time we are sad, there are even chemicals, the same chemicals that are produced when we are angry, are produced when we are sad. Oftentimes, especially in adolescents and young adults, when an individual is very sad, they often act out. They often behave, or they often self-harm, not with the intention of dying, but with the intention of just acting in that moment. And in certain situations, they may succeed and die by suicide. But majority of the times, individuals that act on that self-harm and do not die by suicide and end up in emergency or in my practice, when you will ask them to say, are you still thinking of not wanting to live? Majority of the times they will say, no, I did not want to die. It was in that moment I was experiencing psychological distress and I did that act. So I'm giving you this example because all of you have experienced anger and you've behaved in certain ways, and after you are calmer, you feel guilty, or you feel, okay, I should not have done or behaved in that way, or I could have done something differently. So when it comes to suicide and self-harm, especially in young adults, it is not with the intention of dying, but is in the moment of that psychological and emotional pain being reactive. And this is why we need to be more understanding and supportive when we have such situations. So that's one principle of suicide that I'd like to share with you. The second one is that suicide is also a symptom of chronic mental health conditions, such as major depressive disorder, bipolar disorder, schizophrenia, generalized anxiety disorder, post-traumatic stress disorder. All these chronic mental health conditions that individuals are either inherited or grow into can actually predispose one's individual to actually want to die by suicide. And that is a mental illness symptom. Individuals that are bipolar, who are diagnosed with bipolar mood disorder, have a 30% increase of risk of a complication of dying by suicide. An individual who is major chronically depressed, where clearly the brain, if we're going to do a brain scan and MRI, we're going to find clearly there's a disruption in different parts of the brains and the chemicals. It is not that the person is doing it on purpose, but the person's brain is not physically well. These individuals, actually, studies have shown that there's a 50% increased risk of dying by suicide. So there is that link as well. Now, here's the thing. If we offer them the treatment and the support, they are going to abate from dying by suicide. Okay? So that's the second thing. The third thing is amongst adolescents and young adults. The second leading cause of death in individuals from ages of 15 to 29 is by suicide globally. And it's no different in Zambia. The second leading cause of death in children from the ages of 15 to the ages of young adults of 29 is by suicide. And majority of the times, what we know that it is non-suicidal self-injury. Suicide is wanting to die, but these age groups have non-suicidal self-injury because they are feeling this emotional stress, psychological distress, which cannot be seen in the physical realm. They hurt themselves, either by cutting, either by carrying out certain acts so that they feel some kind of pain. And this is what we call non-suicidal self-injury. Again, there is treatment, there is support, which we guide individuals, and we've seen many, many success stories where when we get them the right support and guidance and community care, they are able to grow into healthy, functioning adults in society. So to answer your question, suicide is not always mental illness. Suicide can be many psychosocial stressors as well as just the means of growing up in emerging adulthood that leads to that behavior. But it has to do with your brain health, and as a society, collectively, we need to have these conversations. And I'm very humbled and privileged to be invited to be in a house of God where I can share this with all of you. We need to have these conversations so that we prevent these premature deaths that are caused by suicide. Yes, thank you. Yes, sir.
Yes, I've got two questions. The first one is, how do you treat mental health, mental illness rather? Do you give drugs? Do you give injections, or do you just give counseling? And the second one is that mental illness is not something which you can feel that it's paining somewhere. That's a reality. And now, how do you just wake up and say, I'm going to the hospital, I'm feeling mentally ill? I mean, I've got an uncle where I come from. He doesn't want to be told that he has got mental illness. He'll keep quiet when around, but he'll start moving around, talking to himself. No, someone cannot tell me I'm mad. He'll put that expression. You don't know that you are mentally ill, but when do you go to the hospital to seek for medical attention that you have got mental illness?
Okay. When it comes to mental illness and mental health, the way you can tell whether, with us as healthcare workers, the way we look at it is three things. Whether an individual is at risk to themselves, whether an individual is at risk to others, or whether that individual, because of the way they're feeling, other people are going to cause them risk. And all of this has to do with the ability for an individual to be able to focus or be part of society and go about their day-to-day life. Now, with mental illness, if an individual is clearly eliciting signs and symptoms of mental illness, in that moment, depending on the severity, because just like physical health, there can be mild symptoms, moderate symptoms, or severe symptoms. It's very difficult to tell at what level an individual is. Depending on the severity, an individual may not know that they may need help. So this is where you as friends or family need to intervene and link them with mental health services. And when you bring them to us, we will be able to ascertain to say, are they at risk to themselves? When I say risk to yourself, it doesn't mean, okay, that person may not want to leave or want to hurt themselves. No. It also means self-neglect, not going to sleep, not being able to wake up on time, or sleeping the whole day, not eating well, not grooming themselves, poor hygiene. These are all things that we are certain to say these are risks to themselves. Okay, not being able to be productive, not being able to focus to say, okay, it's now time to go to work, or it's now time to focus, or being irritable all the time when children are around or when something is happening, you are just irritable all the time. Or you are in class, you are unable to focus. Someone is teaching you and your mind is just somewhere else all the time. So these are things that we say risk to self. Then there are risks to others. You're always irritable, you're always stressed, you're always anxious, and you may hurt or harm others around you. Or you may say things that may upset someone else. So this is risk to others. And of course, if you're severely unwell, people may attack or harm you or stigmatize against you. So this is how we are able to tell. With respect to mental health, and if a person is not able to identify, how can you tell that a friend or family may need help? Because you live with them or you know them, there are three pillars: their mood, their sleep, and their ability to focus. Mood is, individuals. I myself, in my home environment, I'm a very closed-off person. Between my siblings, my family, I'm very closed off, and they all know that I'm a quiet person at home. When I become very excitable or irritable, they know that this is not the Naeem they know. So that is my mood. When a person's mood starts changing from the usual self, you know that, okay, this is not okay. Sleep. A person is not sleeping well or is sleeping excessively. The sleep has been disrupted. This is another way you can tell, because your brain needs to rest. That is the only time the brain is able to create that environment for normalcy. Then diet. Either the person will stop neglecting eating or will eat excessively. Okay? In yourself, you will find that, the food is just fine, but you find that there's less salt or there's less, enough taste or something, and you'll think, no, there's not enough salt. So these are ways you can tell in subtle ways to say, okay, my mental well-being may not be 100% at this moment. So now, when it comes to treatment, just like physical health, there are different ways of treatment, and we've come a long way with our studies with neuroscience and treatment in mental health. There is what we call medication. For severe mental health conditions, there are medications that we give that help with the ability for the brain to get back to normalcy with the chemicals that they are there in our brain. So there are medications that we give, and there are hundreds and different of types of medication that we give. That's one. Number two, in the medication, there can be medication in terms of pills, or there can be injectables. Okay? And now we also have patches that we just put that enable people, which are topical, which you can just apply on the skin as well. So there are different types of medications that are there. Then on the other hand, we also have what we call therapies, psychotherapies. It is not counseling, because counseling is where you offer support, and you listen, and you offer advice to a person. With psychotherapy, this is where you are actually identifying the different ways a person thinks, the different ways a person is able to find solutions, and the different ways the person needs to be helped. So there are hundreds of different types of psychotherapies that we offer individuals to help them rethink or restructure and identify solutions to the stresses that they are facing. So there is also psychotherapy that we offer. Okay? And then other than that, for some individuals, we actually also offer the two together, medication and psychotherapies. So this is how treatment is actually offered in mental health and illness. Yes. Okay. 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 All right. So today I meant to focus on young people, young adults and youth mental health. And what I wanted to bring to light to you as a community was to help you understand on concepts such as suicide, and why is it that in our communities we're seeing the perceived understanding that there is a rise in suicide. Is it true that there is actually a rise in suicide cases? Or is it that we as a community are becoming more aware? What role do certain day-to-day experiences that young people are being exposed to in our communities play in our mental health and mental illness? And one of the things that is there is what we call social media. Access to social media. Is that a positive thing or a negative thing? So these are some of the things that I wanted to bring to light. Now, when it comes to suicide, as a country, it is not that we are seeing a rise in suicide cases. It is not that we have, suddenly just seen more people coming in with suicide. We have always had suicide cases in our country, attempts of self-harm. But what we are seeing now is that we are more, as a community, as a country, we are more open to talk about suicide, to share suicide stories, and also the media houses are now more open in addressing suicide. So this is what we are seeing. It is not that there is a rise in suicide, but there is more reporting and awareness around suicide. And now more and more people are able to communicate about suicide. So I wanted to share a few statistics around suicide. The first one being that suicide, globally, every 40 seconds that passes by, a person dies by suicide. But the leading number of suicides are in young people, especially young adults until the ages of 29. Other than that, we also know now that there are many different reasons why a person may actually have thoughts of not wanting to leave. And those range from psychosocial stressors, family stressors, financial stressors, to just basic relationship concerns in between children and parents, or children and guardians. So these are certain stressors that may actually predispose to thoughts of not wanting to leave. Then we also know that when it comes to suicide, there are certain things that we need to place within our homes or within our communities that enable us to prevent this vice from actually happening. Things like easy access to means of hurting oneself. One of the common ways that we've seen suicide in our country is that through what we call organophosphate poisoning. That is simply common household fertilizers or doom, the sprays, the mosquito sprays. We need to be aware that in our homes, we need to start making sure that we are keeping these things safe so that young people don't easily have access to them. And we need to start lobbying for such things in our community. Countries like Nigeria have actually banned pesticides from being sold in over-the-counter or in groceries or supermarkets because of the very reason that it is easily accessible, and when an individual is stressed, they can easily get access to it, act, and then that's the end. So these are certain things that we as a community need to start thinking about. Another common means of self-harm in our community amongst young people is that through battery acid. So we need to know that if we have homes where we have easy access to battery acid, we need to keep it away from easy access that people may get access to it. So there are certain things that we need to start looking into as communities as well. But also, you need to understand that for every one suicide, completed suicide, there are still families that are bereaved by that death. So as a community, we need to stop stigmatizing homes that lose loved ones to suicide. We should accord that family the opportunity to at least grieve in a dignified way, at least, because they are going through some kind of uncertainty. So it's very important to understand that for every one suicide, there will be at least 100 to more people that will be bereaved. And as a society, we should stop stigmatizing and be supportive and be there for one another. But other than that, friends, I would also like to say that for every one suicide that is completed, there are 25 other people in that same community that may be going through the same stressors and may act on the act of suicide. So what that simply means is, if there is a suicide in your neighborhood, in your community, where you are living, there is a high chance that there are 25 other people who are going through the same stressors and may actually act on that. So you may think that this may not be something that is affecting you, but it may be someone close to you. So again, on things like suicide, it doesn't mean that it's the end. It simply means that we need to reach out, get those individuals the help that they deserve, because there is treatment, there is support, and oftentimes people feel better once they are given the support that they need. So that is on suicide. Then again, for young adults and mental health, the concept of social media. There is social media. We are all living in an online world, especially in a cosmopolitan city like Lusaka. Easy access to social media, internet. Is that a good thing for young people? It's two ways. It is good if used in a productive way. It is bad if not used in a productive way. Because there's a lot of what we call cyberbullying and need to keep up appearances. Or also amongst young people, the fear of missing out. Fear of missing out in the sense that what is online is not necessarily what is true in reality. So we need to be present as a community and show our true selves even online. If you see that we are showing a lot of negative things online, or we are showing a perceived reality that is fake online, we need to start having these conversations with young people around us so that they are aware that that is not 100% true. That is actually detrimental to a young person's mental well-being. But on the other hand, social media in itself is very productive because there's a lot of good things online. there are many positive things that can be learned from a social community and a network as well. So that is another thing that we equally need to discuss at family level, at community level, at such gatherings as well. Not necessarily just talking about the bad, but also the good. And of course, there's a lot of cyberbullying where an individual always says negative things for another person. So these are things that we equally need to avoid, or we need to call out as a community as well, so that we can create a safe online space in our country and in our community as well. And these are things that we are seeing, especially in our practice as well for young people. So I wanted to bring that to your awareness, so that just in case you have friends or family or young ones, you can actually guide and support as well. Thank you.
Doc, mine is some sort of a follow-up from what my brother here said. As a society, or maybe as a nation, it is okay if one says, I'm going to UTH, I'm going to Levy Hospital, I'm taking my daughter to Levy Hospital or to UTH. But for one to say, I'm taking my daughter to Chainama, it doesn't sit well.
Yes.
It's not easy. Even just to mention that Dr. Naeem was at Chainama, there's just that negative,
yes,
reaction that naturally comes out of. Now, and this is why even for a person like the uncle that he was talking about, to be told, yeah, you are not okay, you are supposed to go to the hospital, it doesn't just sit well as a society. How do you, or maybe as a church, how do you help us in that situation? Because if you are to hear that a brother was at Chainama and, I hope you understand what I'm trying to put
yes,
across.
I very much understand your question and the concern that is in your question. And that has to do with stigma and the understanding that we've always had. Even me growing up, whenever I would behave in an unruly way, I would say, we're in the Chainama case, And I understand, and even as I went through medical school and in my training as a medical student, when I went to Chainama, it was one of those places where I never thought I would go and specialize in. So I do understand the apprehension that comes from the country at large and the community. Every time I do my advocacy or awareness, oftentimes there's also suggestions to say maybe with what we are doing as a public health and mental health specialists, creating awareness, we should consider changing the name of Chainama and rebrand it and introduce mental health services the way we are doing right now. So these are certain things that we can do. But you as a church community, what you can do is continue having these discussions as you have done, inviting me creating this awareness for all of you, for you to know that when you're going to bring someone to Chainama, it doesn't mean that you brought them because of the perceived understanding, but rather because you want to get the help and the support that your family member of your community member deserves. Because as it stands, colleagues, right now we have homes within our communities where we are locking people up, keeping them isolated, which is not right. Because there is treatment, there is support. If you get them the treatment and the support, they'll just be fine. It is just that you can't see the brain, but the brain is actually affected and they need that treatment. So to a community, I would guide as a specialist to say, have these conversations, guide. Of course, because of the same stigma, what we have done in the mental health profession is we are now decentralizing services for mental health at national level, but we started with Lusaka. So this is why Kanyama General Hospital has a fully functioning mental health department now. UTH has always had a mental health department. Chilenje has a mental health department. Chawama has a mental health department. So if you feel overwhelmed to say, okay, there's that stigma that comes from Chainama, you can always consider going to these other hospitals where there are mental health professionals and they can support and guide you accordingly. But the most we can do as a community at church level or at national level is let's destigmatize Chainama and show that it is not what it is perceived to be, but it is for treatment, for mental health. Yes. Yes. Yes.
Good afternoon, doctor.
Good afternoon.
Is there levels of being infectious with mental illness? Especially, I know of a family close to me who lost 2 siblings in 1 year. Both of these young people, first was a boy, had a quarrel with the parents. They are trying to discipline him about his movements. When he killed himself, less than a year later, the younger girl also did the same thing after the difference with parents. To the point where the father was now saying, I should have died myself. And then we are saying he might be thinking of killing himself also. Is there a level of infectiousness in these issues?
All right. So I've actually had global level talks on that discussion to say, imagine if mental illness was infectious the way COVID-19 is, maybe we would have given it the importance that it deserves and the seriousness that it deserves. But what we do know is the way diabetes, sugar disease or hypertension, high blood pressure, which is non-communicable, but it runs in families. Similarly, mental illnesses do run in families. So if I have a family lineage from my mother's side or my father's side where there's a mental illness, there is a high chance that I already have those genes of that mental illness. But that doesn't mean I will have it. Depending on the societal stressors or psychological pressures I go through in my life, those genes will then be initiated and I may end up with that illness. But also, the good news is, because we know that it's familial, we are able to identify, to say, if I have a father or mother who has a mental illness, or an uncle or an aunt, I know I am at risk of a mental illness, so I need to put in certain lifestyle stress mitigating factors that will prevent me from getting that illness. To answer your question, I'm very sorry to hear about that experience, and I can only imagine the overwhelming grief and uncertainty that the father is going through. I would urge you to actually get that the father some mental health support, should they accept, so that they can go through grief counseling and grief support. But when it comes to things like severe stressors, they have a ripple effect. When a family has financial stressors, when a society goes through financial stresses, everyone is eventually affected. So things like suicide, as I said, for every one suicide, 25 other people are affected in that network or in that community, directly affected. So they may actually think or act in that manner by virtue of being in that community, not being infectious, but by virtue of experiencing the same stress and psychosocial factors. And I can only imagine looking at Zambia and having worked in the mental health field for the past 8 years. Whenever we have a suicide case, there is so much stigma associated to that case. Even an attempt of suicide, there is so much stigma that that family has to go into hiding, or that family is alienated from that community or society. That family is identified that, oh, that's the family where that person died. So there's so much stigma. I can only imagine the young sister to that person, the brother that died by suicide, what she went through. And when they had those arguments again, that was clearly a feedback, because if that young girl went to friends or cousins or support, they probably said, oh, you are the one that the brother already died by suicide. So there's a ripple effect. There are so many factors that come in. Why is it that for every suicide, another person acts on that? It's because of all these different factors that come in. So even when we are assessing for things like suicide risk, we often do ask, is there a family history of suicide? Do you know someone who has died by suicide? If that is there, then the risk actually increases because of the same stresses that a person goes through. So to answer your question, no, it's not infectious, but there is a ripple effect, because of the society and the communities that we live in, and we are one. We are a social being. Yes. Yes, sir.
I think my question may be clear somehow from what you've just said because of what is happening in the society and the experience we've gone through. The first question is, does it help maybe to condemn a person whom you've seen that has such a situation? Second one, on interference of marriages, because many people commit suicide, especially young one at the present time after going through. You found that maybe a wife was going with somebody, now the person had just thought of taking rid of his life. Then the other one on property grabbing. That one also we thought maybe you can highlight the church or maybe the community at large, because it has also contributed on such suicide which are happening. The other one is maybe fault finding. You know that the person is going through some difficulties, then you want to waste in a situation, maybe condemning, insulting, undermining. I don't know what you're going to say on these four elements. Thank you.
All right. I appreciate that these are specific examples on how we are. And this is where the very first part where I started to say, health is a complete state of physical, mental, and social well-being. All the examples that have been highlighted here about condemning, property grabbing, relationship concerns, and other stressors like fault finding, these all fall under the social well-being of a community and in a person's life. And all of those in themselves are risk factors to one's mental well-being. An example I'll give you is about judgment and fault finding on other people. Oftentimes, and this is something that we've also seen in many cases, oftentimes if an individual, for instance, if I start fault finding in people, it means I am aware of my own faults, I am very anxious about them, and as a defense, I am very quick to find faults in others so that I avoid others identifying my own faults. So these are things that we need to be aware of. And the counter to all of the points that have been highlighted here is what we call compassion. Compassion, psychologically, is said to be defined as the ability to suffer with someone. That is what compassion means. To suffer with someone else. And if we all practice compassion, it has actually scientifically proven to improve our brain health as well. So if you're going to practice compassion, actually suffering with someone else when they go through something overwhelming, you are there, you are listening to them, you are there present for them. You may not have the money to give them, you may not have the answers to give them, but you are there supporting them. It is also going to improve your own well-being and your brain health as well. But on the other hand, if you find someone going through stressful situations and you make it worse, you may feel that you're feeling okay or you're feeling better, but that actually belittles and affects yourself as well. But indirectly, that will even worsen that person's situation, and they may act in certain behaviors such as self-harming and taking their own lives. Now, talking about relationships, yes, intermarital problems, stresses that come in, cheating, adultery, all those factors. Again, it comes back to the part of the brain that is responsible for emotions. When you hear bad news can be financial, bad news can be relationships, interpersonal concerns. You have certain chemicals that start firing in your brain. And when those chemicals are firing, you act or behave in certain ways in that moment. So what you need to do in that moment when someone is behaving like that is be there, present, and support them. How do you support them? By being present and listening without giving advice, without judging, or without giving solutions, just listening to them. That is actually going to help them control those emotions and not act on those thoughts such as self-harm or suicide. Thank you. Okay.
I heard you say something about focus being a mental health thing. I've noticed that in our generation, there's a lot. I'm not the only person who has experienced this. I doubt if I'm the only person. But then you find that even when you're studying, you can read like even 2 paragraphs, but then at the end of reading it, you can realize that you didn't actually get anything from reading that. And then in some instances, you can be having a conversation with somebody, but then you realize that you actually zoned out when talking to that person. But then on a personal level, how do you think somebody can treat that thing, or what exercises can somebody?
Okay, so I'll repeat what you've shared, and thank you for bringing that up. Reading something, focusing on something, you read maybe 2 or 3 paragraphs and you realize nothing has been assimilated or nothing has been understood. Or you're having a conversation with someone, or someone is talking at you or with you, but you are not listening, you are not present, your mind is not present, you have zoned out. You may be in certain situations, the whole situation passes by, and later on you realize, did that really happen? I don't even remember any of it. Another example would be going maybe from church or to home, or maybe your daily activities from school to home, and you pass by the whole road and you don't even remember the road. All you remember is from point A to point B. This is what we call depersonalization. Depersonalization. And when you are not part of the reality, we call it derealization. And these are psychological concepts that tell you to say, maganizo zapaka. All right? Your thoughts are overwhelming you. You have something else that is holding on to you. And you need to understand that that is a red flag. This means you need to sit down and identify what is it that is stressing you, or what is it that hasn't. Maybe it's not even stressing you. What is it that's got your mind? Where is your mind? Why are you thinking about that? There may be times where you may not be able to even identify what has you, but you need to be aware that, okay, you are not present. And when you identify that you are not present, you need to start putting deliberate steps in becoming more present, by making special steps such as putting that book away and doing something that you're going to enjoy or you're going to be present. Maybe having a healthy meal, or maybe going to sleep, taking a nap. Protective factors such as praying, or having a conversation with someone that you know cares for you and you care for, and talking about it. Because when you do these things, you're going to be able to identify, to say, okay, in this moment, I was not present, but now I have to be present. So you are very right. You are not the only person. Many people experience that, but it is not a healthy psychological experience to experience all the time. Because eventually you're going to reach a point where you may, what we call, burn out, and you may not experience life around you. And you may become numb. So my guide to you would be to invest more in self-care practices. Self-care meaning things that make you feel good about yourself and make you feel okay. Not necessarily happy, but just okay. Yes. Thank you. All right. It's
Good afternoon, Doc.
Good afternoon.
I'm really passionate about this subject because it's really real. Like you said, because we don't feel ill on the outside, so it's somehow tricky. We only get to notice that we're mentally ill when it's really bad. I've heard you speak about the community, but I wanted to ask this question concerning the high rates of suicide that we've been, that we have not even been noticing. I was thinking they are high now, but at least you have highlighted the fact that now we are more open to discussing things. We have this aspect of our culture where children and parents are not very open to each other, so you don't really discuss personal things. As long as they take care of you, you know, when you're sick, they take you to the hospital, they pay the bills, they take you to school. But really, that relationship is missing because, you know, it's sort of disrespectful. You just answer when they ask you. You have that kind of relationship. I think you are able to tell what I'm talking about. Could it be the reason why we have these, one of the reasons why actually we have these rates of suicide, because the young people are not supported emotionally, okay? When they're facing, like when they're a teenager, they're facing identity crisis. They can't speak to their parents about it because their parents will just dismiss it, or maybe they're not really open. When I go home, I just do my homework, say hi to mom and dad, do my chores. There's no personal relationship. And how can that be changed if it is indeed one of the reasons why?
Okay, that's a very good point to bring out, and this is something that we are also experiencing in our practice. So when we look at our Zambian culture and the way we have, and there's already an African proverb from Nigeria that says, it takes a village to raise a child. When you look at the way where we are coming from and where we are now, especially in a city like Lusaka, homes and families have become more nuclear and siloed. What I mean by that is we are no longer extended as families. We are now just seeing families growing up, children growing up with parents in terms of fathers and mothers, that's it. And there's no external support in terms of aunts, uncles, or grandparents being present to help groom communities. Prior, in the older generations, in the past 2 decades, there used to be situations where when a child is overwhelmed and they can't easily go to the parents, they can easily go to an aunt or grandparent and share their concerns and be guided and supported. When a parent is upset or overwhelmed with a child, and the child is scolded or punished, that child is easily welcomed into a relative's home where they are still groomed and supported. But that is no longer the case. We are also now seeing and moving away further to that when it comes to other fields like pregnancy, where a young mother is now pregnant and she is now doing this alone without the support from family. You see, so all of these things, we are moving away from this community social element of support to individual support structures. And now, children and adolescents and young adults are finding it very difficult to actually get that guidance because they don't know where to go to or who to get support from. So to an extent, yes, I have actually spoken about this, and I call this the generational divide that we are facing, especially in cities like Lusaka, where there's a big gap and we need to be aware. And you've rightfully put it to say we need to start creating communication or maybe even have workshops in communities like this where we communicate to parents to say, how do you communicate to a child? And also with children and adolescents and young adults to say, how do you communicate with your parents? How do you have these sensitive discussions? Because if we're not going to do that, we are going to see more and more differences and divides, and we are going to see more young adults growing into mental illness because of these challenges that we are facing. Because in as much as societies are evolving, such as social media, there are also things that are changing in our communities, and we need to equally put certain mitigating factors. So that's very true, and I appreciate that you're bringing out that very important point. Yes.
I just want to add, it's not a question.
Yes. Sure.
Yes, it's just an addition, it's not a question.
Sure.
what I've seen, what is coming out much based on suicide cases, I see that to some extent we have got a responsibility as people in counseling and helping people psychologically and also in their social well-being. Knowing that we have got two types of people in society, that are introverts and also extroverts. And I can give you a practical example on two people who committed suicide due to lack of, people to talk to them. One of them is it's actually a brother of mine. We grew up together in the same area, and he graduated well. He started working with ZISC. I think people who work for ZISC, maybe they may even know the guy. He was an introvert. That's from his childhood. He was an introvert. When he's upset of something, he wouldn't even tell anyone that he's upset about anything. Just keep quiet. And this time he's frustrated at the place of work, and he thinks of resigning from ZISC. And the managers call him back, and it was still frustrating, not until he committed suicide. So it's our duty to actually track the personalities of people around us, the people who may not even be willing to talk to us, but we might find time to talk to them. Another one, as educated as she is, she was my lecturer. She used to lecture me in psychology in 4th year. And she's frustrated also at the place of work. And the husband is in UK doing his PhD. And this woman, she has got no one to talk to. The sisters are busy, the brothers are busy at home. She's only with the kids. And at the place of work where she needs to find comfort, they're frustrating her. You see, so she ended up committing suicide. So I'm saying that it is our responsibility to counsel people and also to share what we have with people. We may never know what they're going through because others are introverts. Others, they may be excited as extroverts as they are. But we need to think beyond their excitement. Thank you.
Thank you for that. I'm sorry for your loss, but this is what I said. The best people are people that have lived experiences. And I'm really grateful that you've really summarized that. And we need to be present for people. We need to be aware of the people that we live with and how best to support them, because who else if not us, especially in our own homes. There's actually a question online. One of the people listening in have asked, what causes postpartum depression? So postpartum depression is depression. Depression is simply low mood, persistent low mood that an individual cannot overcome. And this often happens after or during delivery. When a woman is pregnant, the woman goes through certain hormonal as well as physiological changes that can predispose a woman to low mood. But many times people think that it's just because of the hormonal changes, but that's not the case. There are also other factors that are present, such as psychosocial stresses that a young mother or a mother at any age may be experiencing that can predispose to postpartum depression. But then there's also the point of expectations or being ready for that delivery and for that child. And that leads to certain kind of stresses that that woman may not be able to cope with and may not be aware of, and that is what leads to that postpartum depression. However, there's also another concept known as postpartum blues, where a woman after delivery often feels low, which is very, very common. And that is just normal. So oftentimes postpartum blues are very common. We only say that it is a problem when it persists for more than 3 weeks after delivery to up to 2 years after delivery, where a woman that is delivered is unable to cope with the pregnancy that she went through, including being able to bond with the child. So there may be many, many causes. It could also be certain physical stressors that a woman went through during delivery themselves. For instance, when a woman goes through delivery, oftentimes they go through antenatal support and guidance on how to actually go through delivery. But during delivery, certain complications may happen, or it may not go according to how they expected it to go, and that can also predispose to postpartum depression. So there are many, many causes. Of course, we also know that there is also a link of genetics, familial genes that can also predispose to postpartum depression. So it's not one thing. There are many factors that can predispose to postpartum depression. But again, I'm always the bearer of good news now with mental health. There is treatment, there is support, and should you experience postpartum depression, or should you have a partner or anyone you know who is experiencing some kind of low mood, please link them to mental health professionals such as ourselves so that we can support and help you live the best lives that you can possibly live. So with that said, I come to the end of my presentation, and I really appreciate and honor your time, and thank you for this invitation. Thank you.
I hope we learned something from the presentation. For me, I have two take-home issues. The first one is that if you think you have an unhealthy mental state, you need to ask for help. The same way, if you think you have diabetes, or you have diarrhea, or you've fractured your arm, you go to the hospital. It's the same way, if you think you have an unhealthy mental state, you need to ask for help. And then the other thing is that all mental health illnesses can be treated. So it is possible. There's no need for us to think that a mental health diagnosis or mental illness diagnosis is a condemnation, because we've been clearly told that all of them can be treated. I'd like to thank Dr. Dalal for taking the time to come and speak to us. I hope this is just the beginning of many opportunities that will give him to come and address us. If not himself, he's from a network of mental health providers. I'm sure he can help us by giving us resource persons. I think we are supposed to have another one, but this is for a much younger group that is going to present with. So in closing our service, maybe we'll stand up and sing one stanza of the theme song.